My name is Gaila. I'm 37 years old. I had a baby, and then my body changed. I had saline implants, and they started rippling, showing themselves, and they didn't look good.
Gaila is a physician in Austin, Texas. She flew to Los Angeles to see me to have her breast implants removed and replaced.
I appreciate that. That's because you're a physician yourself, so you understand.
The original surgery consisted of a breast augmentation through a periural incision, and the implants were too large. You don't know what size they were, though.
Back in the 80s, the epitome of beauty was boobs on a stick, being as thin as you can, but as big-busted at the same time.
The problems that you're complaining of are very common with saline implants, particularly in individuals as thin as you. I mean, you're very thin. Gaila has had breast implants in for about a decade and had some problems with them. She wasn't completely happy with the size, so she wanted us to put in smaller implants to give her more natural-looking breasts. We're going to do it through the same incision that you originally had. I mean, you're in this field, so you know there's always a potential risk of complications from surgery, like infections or a hematoma, sensory changes in the nipple, things like that. I mean, we'll do the best we can. I can't promise.
I was very nervous. And that's part of also being a doctor, too. If you don't have to do something, don't do it. You know, so all these voluntary procedures, these cosmetic procedures, you kind of have in the back of your mind, like, well, why are you really doing it? You know, why are you putting yourself at risk when you don't need to?
When it comes to elective surgical procedures, I try to avoid using the word need. Most of my patients don't need to do these things at all. It's a matter of what they want.
I want the girls and the boys to provide input for the breasts.
Okay, no problem.
Take a vote. You can have a whole debate in the OR as far as I'm concerned. As long as they look pretty, gotta be beautiful.
Okay.
Is Lisa going to stroke too?
Yeah.
Oh, great. Here I told you yesterday not to be working, and now that I'm here, I want you working.
I'm coming right away.
During Gaila Tricky's surgery, Lisa did scrub in on the case. And actually, she was very helpful because at one point in time, she made some suggestions about positioning the implant on one side that I think were very helpful.
The breast just fell a little bit too laterally, so Dr. Handel just went in there and altered the pocket and put a couple stitches.
That was a good suggestion.
I think Lisa's got some special insights, having gone through so many breast implant operations herself. I followed orders, I did what Lisa suggested, and it turned out, I think, to improve the result quite a bit. We took out her saline implants, and then we modified the pocket and closed it off on the sides and opened it up towards the center so that we could sort of shift her breasts more to the midline, give her improved, cleavage. And then we put in a brand new pair of smaller implants.
We're all going, that looks like.
Really real? Okay, I think we're going to stick with that. Hopefully she'll be happy. If not, we'll be back again. This was really my first chance to see Gaila since surgery, so I was very excited to see her. Yeah.
So my only question is, like, right now, they're smaller and natural, and they have like a nice perkiness, and so I was wondering, are they going to maintain that, or are they or is that just preoperative swelling, or what can
There's
I
not
expect?
that much swelling.
Yeah, that's
the only thing we worry about
is a little tender.
I see a little bit more swelling on the left
Right.
too, but no, I think the shape's going to be excellent.
Okay, good.
The shape of the breasts, the symmetry, the curvature, the position of the nipple, everything was just excellent. I was just thrilled with the way she turned out.
Your breasts look awesome. The shape is so much more natural now.
Oh, I love it. They are soft and they rest instead of hover. They're great.